So when doing FBAs, the first thing that we start off with is, since I'm a case manager, I typically can oversee a lot of kids at the same time because I'm not working directly one-on-one with the client at all times. I am sometimes, but not every single day. So if a therapist comes to me and tells me that they have been seeing a new behavior in a client, or I've seen a new behavior in the client, I typically go to the supervisor, which is the BCBA, and I tell him about the behavior. We start collecting ABC data on the behavior, and we try to get at least 2 weeks worth of the behavior to make sure it's not just something that's like in the moment. Once we get enough data, which is about 10 to 14 days worth of data, we start up a FBA, or well, before we even start the FBA, once we get all the ABC data, we look over it and we try to determine the function of the behavior. We try to figure out which one is causing the behavior to happen the most. We then talk to the parents about if they've noticed this behavior at home, and if they have, what have they done for it. Once we get that out the way, we typically do an FBA, which the FBA process starts with the client's name, the date of birth, describing the behavior. So we try to be very, very descriptive when it comes to the behavior because we always want to make sure that is observable and measurable. We list the strengths of the students, the description of the behavior concern, physiological and medical factors. We also ask any questions to the therapist that is tending to the child, or any questions to the parents. We have interviews with parents and therapists, try to see if anything has changed at home that could cause the behavior. We talk about skill deficits that could be related to the behavior or the concern. And then we typically make a plan based off of that FBA. And we also have a BIP in place because that is our behavior intervention plan, which it lists examples and procedures of what to do when this behavior occurs, and how you can block and redirect the child, and what to do. And we also want to make sure everything is implemented correctly. That way, the behavior is reduced and the appropriate behavior is increased. So we won't see, like, for instance, if a child is hitting when they don't get access to a tangible, we want to make sure that instead of hitting, they act appropriately for that. So we use a lot of differential reinforcement also. And we try to make sure that we carry out the plan for at least 2 to 3 months, or when the behavior is not seen any longer and is extinct.